Hi, this is Dr. Dallin Robinson. I want to give you some information on solutions for chronic knee pain, and that includes even bone-on-bone knee pain. When we take a look at the knee, we want to know that it's tracking where it should be. It's hard to believe that a joint as flexible as the knee has a particular spot that it needs to track, but it does, and we fix that and it works better. We want to see that the muscles are all balanced and strong and stabilizing that joint the way it should. And there's some other things that we do to help regenerate that knee and make it work better. You see, our main focus is treating patients that suffer from chronic pain. That includes knee pain, and that also includes bone-on-bone knee pain. You see, my name is Dr. Dallin Robinson. I've been a chiropractic physician here in Slidell in private practice for over 35 years. Our main focus is helping people with chronic health conditions regain their health without having to rely on drugs, surgery, or shots. And we've successfully treated hundreds of cases of knee pain, and even people who have been previously diagnosed with bone-on-bone knee pain. What we do here works. You see, the average doctor is 17 years behind current literature, research, and technology, and we're keeping up on the latest and employ some things that the majority of people come in have never had done for them. You see, when a person comes in, we like to see a bone like this, a joint like this. There's plenty of cartilage in between there. We realign the bone, balance the muscles. Usually the patient's good to go, sometimes in 1 or 2 visits. When somebody comes in like this, where there's little to no cartilage right here, this person had been told they were bone-on-bone, nothing could be done, just wait for surgery. Even after the first visit, the person was able to move better, experienced relief from it. You can see this has been here so long, they're starting to form bone spurs around the edge. But we've gotten excellent results, even with people like this. One case I had a fellow who had a recommendation of hip and knee replacement. In 2 or 3 months, we had him back playing basketball with his teenage son and beating his son and riding his bicycle for miles. Years ago, when knee replacements first came out, and before I started really working with the knees the way I do now, knee replacements were wonderful. I saw people whose legs were bent way out to the side get that replaced so they could walk without pain. It's great. But over the years, we have found that surgeries don't always work out 100%. Knee replacement surgeries don't work out 100%. It is not a simple surgery, and it is not. It's from what I hear, it's very painful. And there is a high risk of infection. I had one gentleman who had already had a hip replacement. They were telling me he needed his knee replaced. When his hip had been replaced, developed an infection in there. They had to go in, take out the hip joint, wait, treat him for months until it cleared up, then go back in and put the hip back in. So there's a high risk of infection. Knee replacements do wear out, and they have to be replaced. So most good knee surgeons will tell you, do whatever you can do to push it back as long as possible. And that's what we're able to do for people. Another problem that knee replacements have is that they produce something called particulate disease. The ions, the metal ions, leak out and into the body, and sometimes we actually see the inflammation around the knee. So there's a downside to knee replacements. If you absolutely have to have it, it can be wonderful. But there can be a downside too. You see, what we do when a person comes in, we don't do just one thing for knee pain patients. We do a variety of things, and what we do works, and patients improve, and their quality of life improves. So what we're asking is, let us prove to you that it works. When a patient comes in, we do a knee exam. We see if that knee joint is tracking the way it should. Like I said, there's supposed to be a particular spot that it tracks in. When it's not in that track, it binds with every step you take. If it's binding, it's going to wear out. We look to see if the muscles are strong, all the muscles that stabilize that knee and move the knee, if they're all strong and balanced. Dr. Jeffrey Bland several years ago referenced a research where they had taken an animal, disconnected one of the muscles from a joint, the joint began to degenerate. They went in and reconnected that muscle where it was supposed to be. The degeneration started going away. So that's what we see with a lot of people. The joints are degenerating because they're not tracking right, the muscles are not doing their job. We also look to see if there's tenderness in the tendon insertions. We look to see if something called large diameter afferents are working the way they should. These are nerves that tell your brain where your joints are. And if your brain does not, if it's not getting the information of where the joint is, then it does not know what to tell the joint. Sometimes weakness is simply the brain not knowing where the joint is. And so we want to make sure those large diameter afferents, those nerves that tell your brain where the limb is, we want to make sure they're working the way they should. What we would test for, we'll test for muscle strength, we test for tendon insertion tenderness, we test for those large diameter afferents. We want to know that there's stability in the knee, and the back, and the feet, because those all have to work together. We'll test muscles like the popliteus, the adductors, the tensor fasciae lata, the psoas, the sartorius. These are muscles that stabilize the knee. We'll look for tenderness on the tendons like the infrapatellar tendon and the sartorius. If those are tender, then that joint is not working the way it should. And once again, I expect to see results, the beginning of results in 1 to 3 visits, so that we both know that a patient is in the right place. We will frequently do things like laser. Now, laser produces, it stimulates the production of adenosine triphosphate in the cells. ATP, or adenosine triphosphate, is the fuel that promotes cell reproduction and growth. It promotes healing by stimulating fibroblastic activity, increases metabolic activity, reduces abnormal adhesions, decreases inflammation, increases vascular and nerve activity, and decreases pain. When you go outside this country, they use laser, cold laser, for all kinds of things that the general public generally is not used in this country. But if you go to the major sports teams, they're using laser, but you're probably not hearing about it. We also do something called percussion release therapy with a percussor, and the percussion release therapy, it helps to remove scar tissue adhesions, which can be a major component in relieving knee pain. You see, scar tissue forms in the body as a temporary patching mechanism for wounds caused by surgery or trauma or repetitive stress. And the scar tissue connecting the tissues not normally connected, those are called adhesions. And the adhesions can entrap nerves, cause pain or numbness, and limit the range of motion. So percussion release therapy is something very good that we do on just about every patient if they need it. Now, undiagnosed pain and restricted mobility are likely to be caused by some type of scar tissue adhesions. So we want to help with that. There's something else that we do, pulsed electromagnetic fields. Now, pulsed electromagnetic fields for humans was discovered by a NASA scientist. You see, pulsed electromagnetic field technology generates a pulsing electromagnetic field that's beneficial to supporting the body's natural healing ability. And it directly affects the system responsible for healing the body. You see, no healing, repair, or growth takes place in the body without electromagnetic signals or electric impulses sent by the central or peripheral nervous systems. And pulsed electromagnetic field has been found to induce GABA, which is an inhibitory neurotransmitter, which calms and relaxes certain parts of the brain. And when the brain relaxes, the parasympathetic nervous system begins to take over, and the body can start continuing to rest and relax and heal. If you do a search on PubMed, there are over 500 studies showing that pulsed electromagnetic therapy is useful and beneficial and helpful. You see, pulsed electromagnetic field is proven effective for increasing endorphins, which results in pain relief. It increases also, in addition to laser, it increases ATP, which is adenosine triphosphate, the fuel that the cells use. And It helps to stimulate nerve and tissue regeneration. It helps with immunity. It allows for better oxygenation and circulation. It improves sleep and the production of human growth hormone. It helps with relaxation and stress reduction. It improves the parasympathetic, which is the rest and digest side of the nervous system. And it has also been shown to help build stronger bones. A lot of good things that pulsed electromagnetic frequency is good for. So if you're interested in eliminating your knee pain without having to rely on medication, surgery, or shots, call our office, 985-288-5520, and ask for the knee pain evaluation. We, once again, expect to see results in 1 to 3 visits, so we'll talk to you about 3 visits. Now, we help a lot of chronic pain and a lot of knee pain, even bone-on-bone knee pain. And if we accept you as a patient, it's because we sincerely believe that we can help you too. And like I said, we want to do a trial to make sure that you're in the right place. So once again, my name is Dr. Dallin Robinson. I'm at 985-288-5520 right here in Slidell, Louisiana.